Supertext Sweden, Kadin DIY, or the Chamber of Commerce and Industry of the Special Region of Yogyakarta, Pintek, GKR Indonesia, Royal Blue Lantern Foundation, APTISI, and the Indonesian Australian Business Council. So we have a good group of people here representing these organizations that are here with us today. So in beginning, we will listen first to, we have with us today the honor to have Her Royal Highness, the Crown Princess of the Yogyakarta Royal Palace, Crown Princess Gusti Kanjeng Ratu Mangkubumi. And as all of you know, she is a very prominent leader in Indonesia and has led and is leading the effort to support society and people fighting this COVID situation, in which through the Royal Palace and her movement called Gerakan Kemanusiaan Rakyat Indonesia, or GKR Indonesia, have led vaccinations and have led support and supporting people from marginal and poor societies that are right now facing this COVID challenge. And that also, she is the chairman of the special region of Yogyakarta's Chamber of Commerce and Industry. So I would like to allow Her Majesty, Her Royal Highness, the Crown Princess of the Royal Palace of Yogyakarta, Gusti Kanjeng Ratu Mangkubumi, to share a few words. Gusti, are you already here with us?
Yes.
Yes, thank you, Gusti. Thank you. And Gusti, before you start, I want to report to you that we have with us here today Her Excellency, the Ambassador of Sweden, Her Excellency Ibu Marina Berg, and we have here with us today your good friend from Sweden, from Stockholm, Mr. Martin Jacobson, from the CEO of Supertext, and we also have coming in from Nice, France, your good friend also, Mr. Iwan Fine-Silver, the CEO of Pintek, and also Dr. Riris Andono Ahmad, the very well-known UGM epidemiologist, and also your good friend, Dr. Andreasta, the head of the Center of Public Health and Management of the University of Gadjah. So a good group, Gusti, and we have representation from the various organizations that are participating and collaborating today. So thank you, Your Royal Highness, Crown Princess Gusti Kanjeng Ratu Mangkubumi, to be here with us today. And please share your thoughts on how countries are, in this particular case, Indonesia and Yogyakarta, is coping with the COVID pandemic from the public health, economy, and the technology aspect. Gusti, the floor is yours.
Yeah, thank you, Mas George. Hello, everyone. To be honored to be with you this afternoon to share about health during the pandemic, and also the economy and also the technology. Mungkin selanjutnya ditranslate ya, Mas George.
Yes.
Dari pagi pakai bahasa Jawa nih.
Yes, I'll help translate.
Supaya nggak mix. Ya, terima kasih Bapak Ibu, pada siang hari ini kita bisa bersama-sama. Ya, jadi tentunya dalam situasi pandemi yang sangat berkepanjangan ini, tentunya ya keprihatinan bagi kita semua, bagaimana cara kita menghadapi. Nah, ini pelajaran yang baru yang selama hidup kita belum pernah kita mendapatkan. Jadi seluruh dunia kita belajar bersama bagaimana menghadapi COVID-19 dan juga varian-varian yang mengikuti. Nah, tentunya banyak sekali hal-hal yang kita learning by doing gitu ya. Kemudian kita ada beberapa experience baik yang bisa dianggap berhasil atau experience yang memang dianggap gagal gitu. Tapi semua kita belajar. Selama 2 tahun ini, hampir 2 tahun ya, kita belajar menghadapi situasi seperti ini. Nah, tentunya ke depan ya mau nggak mau kita hidup berdampingan dengan situasi seperti ini gitu, mau nggak mau gitu. Nah, tentunya bagi sisi kesehatan memang berat, bagi sisi ekonomi lebih berat lagi gitu. Tapi satu sisi kita diberi satu celah sama Tuhan ini, gitu, bahwa kita dimudahkan dengan teknologi, gitu. Nah, kita bisa menggunakan teknologi itu dengan sebaik-baiknya. Nah, tentunya bagi masyarakat yang tidak akrab dengan teknologi, ya mungkin memang perlu dibantu oleh generasi muda. Gitu. Nah, sekarang tentunya peran dari generasi muda yang membantu para orang tuanya atau para senior gitu untuk menjadi jadi memang udah waktunya lah yang muda membantu yang senior, bukan yang tua ya kita bilang, tapi kita membantu yang senior untuk ayo bersama-sama kita bangkit, bersama-sama kita memperbaharui pola ekonomi gitu. Dalam artian ekonomi dan teknologi itu sekarang sangat akrab. Gitu. Tentunya kalau kita bicara dari sisi Kadin, ya dari sisi UKM-nya, kemudian promosi usaha kita gitu ya, ya semuanya sekarang sangat-sangat bergantung pada teknologi. Gitu. Jadi ya ke depan ini ya kita sangat sulit kalau kita masih beranggapan bahwa hidup atau pola hidup kita nanti setelah pandemi ini selesai akan seperti yang kembali lagi seperti yang dulu gitu. Nah ini pasti tidak akan berhasil gitu. Karena selama pandemi ini yang sudah 2 tahun ini kita dipaksa untuk beradaptasi dengan kondisi yang seperti ini gitu. Tapi satu sisi kondisi seperti ini tentunya satu sisi baik lah dalam artian sekarang kita makan juga harus kita akan pasti bertanya makanan ini sehat atau tidak. Kemudian soal pembangunan. Nah, bagaimana dengan lingkungan? Akhirnya kita juga peduli terhadap lingkungan gitu. Kemudian kita juga peduli akan diri kita sendiri gitu. Batuk sedikit kita langsung minum obat. Dulu batuk didiemin aja gitu ya. Pilek gitu ya atau flu gitu. Ya, akhirnya kita dulu didiemin aja nanti sembuh sendiri gitu. Tapi sekarang enggak, cepat-cepat kita harus minum obat. Mau obat, mau vitamin, tapi akhirnya kita peduli dengan badan kita peduli dengan makanan kita gitu ya. Jadi ya mau tidak mau ya ke depan akan seperti ini gitu. Kepedulian terhadap diri sendiri, kepedulian terhadap lingkungan, dan bagaimana kita bisa menggunakan teknologi sebaik-baiknya. Tapi juga perlu diingat, kalau sekarang sudah akrab dengan teknologi, nah tentunya jangan sampai teknologi itu mengatasi kita, bukan mengatasi kita. Jadi menguasai kita gitu. Itu juga penting gitu bahwa kita sekarang dihadapkan dengan mudahnya teknologi, akrab dengan teknologi, tapi juga jangan sampai teknologi menguasai kita. Nah, ini bahaya. Jadi kita lama-lama juga menjadi manusia robot kalau gitu ya. Gitu. Nah, mungkin sedikit lah dari saya, Mas Jos gitu. Karena dari sisi saya ini berkegiatan di sosial gitu ya. Jadi saya sedikit banyak yang mengetahui apa yang permasalahan-permasalahan ataupun selama pandemi ini yang dihadapi oleh masyarakat. Mungkin dari saya itu dulu, Mas Jos. Atur.
Terima kasih Gusti Kanjeng Ratu Mangkubumi. Thank you, Your Royal Highness, Crown Princess Gusti Kanjeng Ratu Mangkubumi. Just to for our international audience, just to summarize what Her Royal Highness has just shared with us. Again, on the issue of the public health, definitely Her Royal Highness has shared with us. It is a challenge, and in terms of the economy, as around the world, we are challenged here in terms of the impact on the economy. And the aspect of the technology element is that in terms of technology, it has been useful, but one I think one underlining aspect that Her Royal Highness has mentioned is that society needs to be educated how to use this technology, especially from the, not everyone is well tuned into using technology, especially in this Industry 4.0 and all those dynamics. So in a country like Indonesia, and from Her Royal Highness experience, that educating people on how to use technology properly as a solution for facing this pandemic needs to also take into place. And Her Royal Highness also shared with us that the changes of pattern of living, or Her Royal Highness mentioned pola hidup, the changes of pattern of living is very significant, be it on how we face the environment, on how we take care of ourselves, and how we use technology. And another underlining aspect that Her Royal Highness has shared with us is, don't let technology make us make us like robots. That's correct, Your Royal Highness. Yeah, Gusti. Don't make technology then dominate us, that we become robots and we lose our humanity, if you might say, is what Her Royal Highness has shared with us. So thank you for those opening remarks, Crown Princess Gusti Kanjeng Ratu Mangkubumi. Terima kasih atas sambutan pembukaan tadi, Gusti Kanjeng Ratu Mangkubumi. I know you have a very, very heavy schedule, especially during these tough times. You're fighting the pandemic, working with society and clusters of groups. We really appreciate the Royal House, the Palace's efforts in the vaccinations. I think the people here really appreciate that. And we also appreciate the efforts of the Royal House in providing the basic needs of societies. And I know you're leading in that particular aspect, Crown Princess. And I know you haven't got much rest. Yeah, you haven't got much rest because of the efforts that you have been leading. So, but we really thank you, Crown Princess, for joining us today. And before I allow Ambassador Marina Berg, the Swedish ambassador to Indonesia, to share with us her thoughts, I would like to recognize also Mr. Per Berglund, coming from out of Portugal, joining us today. He's a significant investor in health companies around the world, including in digital banks, and one of Sweden's leading business persons who have also are involved in various businesses in Sweden. And I want to also recognize Professor Johan de Veyer, a leading expert in the health sector, coming from out of Sweden also. So Professor, thank you for joining us today also. So, and we have also with us from Australia, who's also, but currently now in Jakarta, Mr. Roby Valentino, one of Australia's leading businessmen involved here in Indonesia. So thank you, Pak Roby, for joining. So with that, now I would like to lead, with your permission, Your Royal Highness, Gusti Mangkubumi, I would like to lead to the distinguished ambassador of Sweden to the Republic of Indonesia, Her Excellency Marina Berg, who have very much supported Indonesia, and specifically in this case, Jakarta also, throughout her term in Indonesia. And I know the Crown Princess was in 2019 with the King Gustav in Sweden, in Stockholm. So we thank you. We thank the embassy for your continuous support. And so, Ambassador, Your Excellency, Ambassador Marina Berg, the Zoom floor is yours.
Thank you very much, Pat George, for the Zoom floor. Good afternoon, everyone. Selamat sore. Let me first acknowledge the distinguished speakers of today's webinar. Your Royal Highness, Crown Princess Mangkubumi, it's an honor to meet you again. And Mr. Iwan Fainsilber from Pintek, it's an honor. And Mr. Martin Jacobson, Supertext. and Dr. Riris, Andono, Ahmad, and Dr. Andreasta Malyala, both from the University of Gadjah, Mada. It's an honor to meet you and talk here at the same time as you. Ladies and gentlemen, it is a true honor for me to take part in this very timely and important event. I'm so happy of the fact that it's also being conducted in conjunction with the celebration of Indonesia's Independence Day. The COVID-19 pandemic is really testing our society, and it is ongoing. It has affected and continues to do so severely both Indonesia and Sweden, and indeed the whole world. It has taken the national and international health, economic, social, and political order. It has taken us and shaken us. The effect on people's health and the loss of lives is simply devastating. The effect on people's health and the loss of lives, yes, it's definitely the most devastating thing, but at the same time, the pandemic, as well as actions taken to contain it, has had a dramatic economic consequences, which is evident both in Sweden as well as in Indonesia. The pandemic respects no borders, so we have to take this global crisis with global consequences, with global solutions and global solidarity. In our international response, we need to promote a strong multilateral system and the rules-based world order with the UN at its core. As we tackle the immediate effects of the pandemic, we also have the opportunity to rethink development. We need to find a way together of building back better, inclusive and sustainable. When countries have surviving and recovering from the effects of the COVID-19 pandemic, the focus should be on meeting the future more effectively by careful cooperation rather than wasteful competition. Countries that will build back in the most possible sustainable way win. To start off my remarks, I would like to take this opportunity to share with you some of the Swedish experiences on how we tackle the pandemic. Even if countries are at different stages in handling the pandemic, notes from policy making and implementation of regulations can still be compared between countries in order to learn from one another. Just steal with pride. That is what we all should do. Just to be absolutely clear, first of all, the Swedish way of handling the pandemic is not a one-size-fits-all countries or all solutions. It is one way among many, but it could serve as an example. Since the outbreak of the pandemic, the Swedish government has presented a range of different measures. The government's overarching goal has been since the start to safeguard people's lives and health and to secure the capacity of the healthcare system. Great efforts have been made to reduce the pace of the COVID-19, to flatten the curve, so we say, so that large numbers of people do not come ill at the same time. From the very start, the Swedish Prime Minister Stefan Löfven was clear that this is a crisis that will continue for a long time, and it will be tough. He asked everyone, the whole population, to take responsibility and to do their share. The truth is, only together could and can we overcome the pandemic. In early 2020, the Swedish government classified COVID-19 as a disease that constitutes a danger to society. With that, it opened up for the possibility for the government to decide upon extraordinary communicable disease control measures. It has, however, been central for the Swedish government to implement the right measures at the right time, to achieve the best possible impact, to safeguard people's lives, health, and jobs. but to do that in a coordinated manner between government agencies and the government. The measures have been carefully carved out by the government and the government agencies in order to reduce the pace of the virus spread. At the same time, their effects on society and public health in general also have been taken into consideration. In very close coordination and cooperation within the government, as I just said, and between the government and the government agencies, the measures taken have been received constantly throughout the development of the pandemic. An important starting point is careful consideration of the expert knowledge that contributes, that each and every government agency contribute with. These expert agencies can make recommendations to the government on the measures they consider should be taken. The agencies can also take decisions of their own. In Sweden, crisis management is built on the principle of trust and responsibility. In practice, it means that public agency responsible for a particular activity under normal circumstances is also responsible for that activity in crisis situation. The principle of trust and responsibility is also dependent on the fact that people in Sweden have a high level of trust in the government agencies. This means that a large proportion of people follow government agencies and their advices. In the current situation, people in Sweden have on the whole been acting responsibly to reduce the spread of the infection by, for example, restriction in their social contacts. Also, for the measures to be persistently implemented, people need to understand and accept them. And also correctly pointed out by Your Royal Highness, you need to understand the technology. Strategic communication and clarity on what the government is trying to achieve and how it tries to achieve it has been the key. In short, the efforts and the decisions of the government, the Swedish government, have aimed to, first of all, limit the spread of the infection in the country. Secondly, ensure that health and medical care resources are available. Thirdly, limit the impact on critical services. Fourthly, alleviate the impact on people and businesses. Fifthly, ease concern among people. 6, implement the right measures at the right time. Inevitably, the efforts have had far-reaching effects. The efforts have had far-reaching effects on Swedish society. The pandemic has affected us all. Our health system has coped, however, but not least because of the heroic efforts of health workers, just as here in Indonesia. But it has been under a lot of pressure. We have held in Sweden the schools open throughout almost the whole pandemic. But most adults have been working from home, to the extent that their jobs have allowed it, of course. This has required both societal and technological changes, adjustments, and innovations. We are blessed in Sweden to have a lot of innovative people and companies who both can come up with their own ideas and solutions and also implement new ideas and technologies from abroad. These circumstances have been of use for us to get through this pandemic in the best way possible. So now, which ideas and solutions are needed in a specific country is of course dependent on the particular context. Sweden's needs are not necessarily Indonesians' needs, but I know that there are a number of Swedish companies who stand ready to work and cooperate with Indonesia and to provide technical solutions that are needed here. One such example is Supertext. I'm very pleased that we will listen to its founder, Martin Jacobson, later on, and hear about Supertext solutions that can be offered to Indonesian schools, teachers, and students. Friends, despite the very long distance between our two countries, Sweden and Indonesia share a long history together. Last year, our countries celebrated 70 years of diplomatic bilateral relations. Our relations are built on several issues in many areas, and it stands on a firm basis. And I'm happy to see that the interest from the Swedish industry, from multi to small businesses, is constantly growing. It has been ever since I came here to this beautiful country in 2018. Many Swedish companies truly want to be part of and contribute to the Indonesian's economy. And it hasn't changed during the pandemic. And to do so, they want to do it in a sustainable way. Sweden is the home of many high-tech companies, Supertext being one of them. I'm proud to see how Martin and his colleagues are exploring new ways of communicating with or without internet in this country. During the pandemic, it has been even more evident that easy solutions to communication is important. E-life during the pandemic has grown large, not least here in Indonesia. I'm proud to see that Supertext is taking part of that development. Yes, there is a clear link between health, economy, and climate. But there will be no health without growing economy. And there will be no economy without healthy climate. But above all, there will be nothing, and nothing will be possible without high-tech solution, not least for communication. So thank you once again for having me today and organizing this very important and timely event. And I wish all attendees and all Indonesian friends a happy National Day. Terima kasih.
Thank you, Your Excellency, Ambassador Marina Berg, the Swedish ambassador to Indonesia. Thank you for your remarks, and thank you for also providing congratulations to the Republic of Indonesia as we embark on our 76th birthday tomorrow, in which Indonesia will be 76 years of independence. The Republic of Indonesia will have 76 years of independence. So thank you. And this webinar is in lieu of that. And I've been asked by the organizers from the University of Gadjah Mada that we will have a family photo right now, as we have the ambassador and Her Royal Highness Gusti Kanjeng Ratu Mangkubumi, Crown Princess Gusti Kanjeng Ratu Mangkubumi with us today. So everyone, the organizers have asked us to please open your video screen. Yeah. So we can all see each other via virtual. We are one big community from all around the world now, from Indonesia, Jakarta, Sweden, Portugal, France, and from various countries around the world. So I will give the code to the Center of Public Health, Buleli. Just tell us to smile and we will smile.
Oke.
Silakan Bu Leli. Ya.
Terima kasih Pak Jos. Baik Bapak Ibu, kita akan ada sesi foto bersama. Saya mohon untuk membuka webcamnya dan nanti pada hitungan ketiga saya minta untuk bisa memberikan senyuman yang terbaik dan terindah. Baik. Untuk yang halaman pertama kami persilakan. Sebentar, saya melihat dulu sudah sesuai. Baik. 1, 2, 3, say cheese. Just wait a moment.
Keju.
Okay, and we gonna go to next page. Okay. Untuk Ibu Janet. Ibu Janet dari MMR 21 mungkin bisa dipindahkan Ibu karena itu backlight posisi jendelanya. Oke. Baik Bapak Ibu, untuk di halaman kedua saya hitung ketiga. Mohon maaf Ibu Fitri bisa agak sedikit dekatkan kameranya ya Ibu ya, webcamnya. Karena terlalu jauh hanya kelihatan, iya. Baik. Baik, 1, 2, 3, switches. Just tunggu sebentar. Oke, baik, kita halaman selanjutnya. Ya, halaman ketiga atau halaman terakhir dari peserta siang hari ini. 1, 2, 3, switches. Ya, baik Pak George, saya kembalikan waktunya. Kami persilakan.
Terima kasih Ibu Lely. Thank you from the Center of Public Health, University of Gadjah, Mada. So again, Ambassador, Your Excellency, Ambassador Marina Berg, thank you for those comments. And I think you put a very interesting twist to this. Public health, economy, and the environment. So that is a very, very interesting emphasis. And I think it is very much in relation to what Crown Princess Gadjah Mangkubumi just shared with us, that we also need to take care of ourselves and our environment. That's, I think, what you said, Crown Princess Gusti. So very much in alignment. So again, Crown Princess, Your Royal Highness Crown Princess Gusti Kanjeng Ratu Mangkubumi, Your Excellency Ambassador Marina Berg, the Swedish Ambassador to Indonesia, thank you for providing these opening remarks. As we now step into the discussion for today, terima kasih Gusti Kanjeng Ratu Mangkubumi, terima kasih Duta Besar Swedia untuk Indonesia, Ibu Marina Berg, atas sambutan-sambutan pembukaannya pada siang hari ini. Dan kita sekarang masuk kepada materi dialog. And so now we go into the discussion and with the panel. And we have with us a panel from Sweden, coming in from Stockholm, the great city of Stockholm, Sweden. And we also have with us coming in from Nice, France, and also from the great city of Jakarta, Indonesia. So we have 3 geographical locations coming in from us today to join us to discuss this particular topic. And I will allow to follow through on the Swedish ambassador's comments, Her Excellency Ambassador Marina Berg, who had mentioned about the Swedish companies involved in Indonesia, including Supertext, which we have with us the founder and the CEO of Supertext, Mr. Martin Jacobson, who's also a good friend of a lot of people here in Jakarta, including Her Royal Highness Gusti Mangkubumi. And obviously, Martin, you are not just a techie. You founded one of Sweden's leading messenger companies that is also active here in Indonesia. But you are also a molecular biotechnologist. You studied molecular biotechnology, and so you know a little bit about viruses, I believe. And so Martin, please, share with us how you see this whole issue, because this is a conversation: public health, balancing the economy, and technology. How you see all of these 3 elements coming into play from your experience in Sweden, and what your perspectives are. So, Martin, I will give the floor to you, coming out of Stockholm, Sweden. Dari Stockholm, Sweden, Bapak Martin Jacobson, CEO Supertext, dan juga adalah seorang molecular biotechnologist. Kami persilakan. Please, Pak Martin.
Thank you. Thank you, Pak George. Can you hear me?
Yes, I can hear you.
Thank you. Thank you, Your Royal Highness Gusti Mangkubumi. A great pleasure to see you again. And thank you, Ambassador Marina Berg. Thank you so much for those opening remarks. First, I want to say, Selamat Hari Ulang Tahun Republik Indonesia. Ke-76. Merdeka.
Merdeka.
Congratulations to the Independence Day. Selamat sore Bapak dan Ibu yang terhormat. Saya berharap Anda semua dalam keadaan baik dan sehat selalu. Saya Martin Jacobson, pendiri dan CEO Supertext Swedia. Saya merasa sangat senang dan bangga bisa berbicara di forum ini dan membangkitkan pengalaman saya yang sudah lebih dari 6 tahun bekerja sama dengan berbagai perusahaan dan organisasi di Indonesia. Supertext adalah penyedia layanan hybrid messaging. Kami membuat semua pengguna bisa berpartisipasi dalam chat di grup, baik dengan internet atau tanpa internet, smartphone atau HP jadul. So I have been asked to speak a little bit about the COVID situation from the entrepreneur's perspective in Sweden, and how the digital technology and Supertext support in these tough times in Sweden and in Indonesia. How can we use digital technology to support Indonesia? Next slide, please. So a comment from a non-governmental person: Sweden's COVID strategy is a different path from many other countries. No lockdown. We have had no lockdown since the start of the COVID, and that has been good and bad. A lot of voluntary social distancing and a lot of responsibility put on the people. We have also had very strong governmental support, financial support for people to stay home when they are ill. So if you're ill, you don't have to go to the work. And that is, of course, not a luxury everyone has. This Swedish strategy has been quite successful in many parts, but we failed badly in the elderly care system, where the hygiene rules were not clear, and the people working in the elderly care belong to the low income segment. So they, in many parts of that industry, they had no choice but to work even when they are ill. And that's been very difficult. But in general, we have put a lot of responsibility on the people, and this has worked very well. We have also been able to keep the schools open for almost the whole time. Only the senior high school has been partly closed on a voluntary basis. So moving on. Some people asked me to mention the Delta, what's happening in Sweden now. It is rapidly becoming the dominant strain in Sweden. And we had a big wave of COVID in April, May. And after this, summertime came. In the summertime in Sweden, the weather is very good for being outdoors, and it's very easy to do social distancing. Everyone has been outdoors, and finally, we got the vaccinations rolling in. Among the Swedish population of 10 million, we are now coming out at the other end of our big wave, the wave that Indonesia is maybe reducing in now, hopefully, but we are coming out at the other end. And with the summertime, it's easy to only meet people outdoors. It's been quite good for us. We have 10 million people, but we have a lot of immunity now. At least 1.1 million have had COVID, maybe 2 to 3 in total. Not everyone gets tested in Sweden. And I checked the latest numbers. We have 6.6 million. 80% of all adults have been vaccinated at least once. So that gets us to quite a high percentage. With these vaccinations, people do still get ill, but the mortality is definitely down. And as a layman, I believe we do have herd immunity, or people not worrying so much in parts of society. In the youth segment, it has not been so contagious before Delta, so there is some worry for the youth, but apart from that, people are step by step becoming more and more relaxed. And I think what we have seen with the COVID strategy of Sweden, which Ambassador Marina Berg mentioned, is the value of the holistic perspective, that the overall health, the mental health, the health of the economy, so to speak, has been prioritized in balance with reducing the spread of COVID. And but it's moving to the next slide. We see here, I just thought I'd take a snapshot of today just to share with you today. So these are the 3 big waves that we have had in Sweden. We can see them clearly last year and this year. And right now, maybe there is something coming, but we're all hoping that we have now managed to, COVID has been everywhere, and if not, we have managed to get the vaccinations out. So hopefully we will not have a 4th wave. Moving on. So I wanted to give an example of some of the challenges that we from the technical to digital industry see, and where I believe technology helps and has become a very critical support in the times of Corona. The digitalization that in many industries would take 5 or 10 years has now been done in 1 or 2 years with no compromise. If it doesn't work, you have to fix it. And that's quite unique. It's been a massive change in the Swedish society, and I think also in the Indonesian society. And I thought an interesting example, as mentioned by our ambassador, is the education sector, where in Indonesia, we have the challenge of infrastructure. Just as in Sweden, in the rural Sweden, we have challenges of infrastructure. In Indonesia, which is a much larger country, I believe it's the largest widespread country in the world, and it's a very challenging geography for infrastructure. So we have a lot of people that are unable to access internet every day. And looking at the education, we have up to 30 million school and university students that are having difficulty to participate in digital learning due to lack of infrastructure, lack of computer, or not having a smartphone. Everyone has a mobile phone, but that's it. These people, the golden generation of Indonesia, is the future of Indonesia. And to support them with digital technology and to enable everyone to participate is something I believe is incredibly important. And we see all over the world, the education sector has taken rapid step into becoming digital, Indonesia also. But one challenge here is the 2G, the people with limited or no internet access. How can we help them? And I thought I wanted to explain a little bit, if you move to the next slide, please, about Supertext, what we are doing, because as Marina suggested, and I got a request prior to this esteemed seminar to present a little bit about what Supertext does as a case study, if I may, about how technology can help. Our mission, using our communication of messaging, that works with and without internet, is to bridge the digital divide and to support the communities across the Indonesian archipelago. Here we can see the widespread use of our users from Aceh to Papua. Moving to the next page. The challenge of Indonesia is that there is limited connectivity outside the city centers, and with the low population density and challenging geography, it's very expensive and actually technically very difficult to provide internet everywhere. We have the green areas here showing the 2G. This is maybe 2 years old, but it's still a very similar picture. The green areas showing the 2G coverage, and the red areas is where they have 3G, 4G, or 5G today. And that is the challenge. We find that I was in a meeting with the West Java government, and I learned that more than half of the senior high schools are unable to do remote schooling because of the lack of infrastructure in West Java, which is one of the richest provinces together with Jakarta of Indonesia. Moving to the next page. So what is Supertext? Supertext is a unique communication channel for people, for all phones, with and without internet. We're building a social media for Indonesia that works like iMessage or WhatsApp, but without an app also. And this is like bringing people a small part of internet. And we found that in many verticals, many industries, there are big needs that we did not foresee when we started working with this technology. Moving to the next page, please. In the pandemic, we enable communication for the unconnected. The lack of communication and challenge of coordination, which is always there, becomes even worse in this time of pandemic. And we are a small contribution alongside many other tools, but we see the need is extremely large in rural areas of society. Moving on. We have previously we have now working with the supporting telemedicine using our technology platform in Papua, which is an area of Indonesia where sometimes connectivity is very limited and coverage is limited. we have, under the guidance of University Gadjah Mada, work to support, and they have adopted using Supertext for coordination and improved response in Papua with regards to malaria and measles and so on. Moving on. We're also working to support local government, to support farmers with digital farming and bridge the digital divide. Today, there is 80,000 mentors to farmers, and they communicate with farmers every day. But the challenge of communication now is extremely high. So these type of tools are very important to people. Next slide, please. So that's what I wanted to share today, and I believe and hope that soon Indonesia comes out at the other end of this wave, just like Sweden, that we got the wave earlier and we left the wave earlier, and I hope soon Indonesia comes out too. I strongly believe in the Indonesia Indonesia future, and I believe Indonesia is a future superpower, and that's why I am investing and building my business in Indonesia. And as an ending, I want to say, Dirgahayu, Republic Indonesia, ke-76. Congratulations. Thank you.
Thank you. Terima kasih, Pak Martin. Thank you for giving those kind remarks for the Republic of Indonesia as we celebrate our 76 years of independence. And obviously, you've been working with a lot of the friends in this group here, the Crown Princess, Gusti Kanjeng Ratu Mangkubumi, and Dr. Andre's Center for Public Health, and the issue of public health or issue of telemedicine in Papua, and with also the Scouts, the Pramuka, under the leadership of Gusti Kanjeng Ratu Mangkubumi. So thank you for that presentation. And obviously, during the pandemic, to the importance of the interconnectivity of the infrastructure. Yeah, I think that's what you discussed, Pak Martin. Ya, 2G, 3G, 4G. Terima kasih Pak Martin atas komennya tadi, dan juga tentunya terima kasih atas penghargaan terhadap ulang tahun Republik Indonesia ke-76 yang akan kita rayakan besok. Dan tentunya tadi Pak Martin sampaikan mengenai bagaimana peranan teknologi, khususnya dalam konteks infrastruktur teknologi yang di era pandemi ini, yang mengkonektivitas antara kondisi-kondisi wilayah di wilayah Republik Indonesia ini yang masih tidak mempunyai akses internet. Jadi disinilah peranan teknologi seperti yang disampaikan Pak Martin, seperti Supertext ini, yang kemudian memberikan konektivitas di daerah-daerah 2G dan 3G dan 4G. Jadi tentunya ada peran di sini. Jadi ada fungsi teknologi yang bermanfaat di dalam konteks ini. Menarik tadi Pak Martin sampaikan dalam hal public health, di Sweden tidak ada lockdown. jadi ini mungkin satu topik yang nanti secara ini menarik juga, karena itu kaitan dengan kesehatan ya, public health ya. Demikian, thank you Pak Martin. And now we move from the great Nordic city of Stockholm, Sweden, to the beautiful city in France, yeah, or region in France, coming from Nice, France. I believe a wine region, yeah, in France, yeah, coming from Nice, France, very beautiful tourist area there in France. We have Mr. Iwan Fine-Silver, the founder and CEO of Pintek, and he is also a major investor in Indonesia in the technology field. Yeah. So, Iwan, we thank you for joining us here today. And so, Monsieur Iwan, the Zoom floor is yours. Please share your thoughts on this particular topic.
Thank you very much, Pak George. Can you hear me well?
Yes, thank you.
Okay, great. So firstly, thank you so much, Crown Princess, as well as Ambassador Marina Berg, for organizing the event today and making the introductions, as well as all the other speakers and UGM. I think I will start by giving a brief background, I think, about myself. So I'm originally from France. I was trained and educated in the UK and in the United States. Worked initially in the UK before moving to for me, the most beautiful country on the planet, being Indonesia, about 4 years ago. I was personally very attracted, I think, to the country in general for the potential that we all believe Indonesia has, yet still has massive underlying, I would say, basic foundational topics that remain to be solved, right? I think some of them were highlighted by some of the speakers today around infrastructure, around access to education, and those kind of topics. So that's what drove me to come to Indonesia about 4 years ago. Started my own business in the country, but also investing in different startups, as you say, tackling various issues in the country. But starting, maybe taking a bit of a step back, and let me highlight, at least from my perspective, how I saw France tackling, I would say, this unprecedented crisis, and what are some of the big differences, and also highlighting some of the work that we've been doing in Indonesia. So I think, first of all, France, has been got hit really hard also by the COVID crisis. Overall, more than 10% of the population ended up testing positive, with 7 million cases for a population of about 67 million. But the reaction, contrarily to Sweden, was to go through very, very strict lockdowns. And so France went through 3 very strict lockdowns since last year. But at the moment, I think some of the push and those restrictions that have been taken have been putting, I would say, the whole crisis a bit more under control versus some other parts of the globe, right? And I think one of the major driver behind this was the fact that France has done a massive vaccination drive early on, getting access. I think that's the first thing, is first of all getting access to the shots, but then really deploying it at scale and fairly quickly. So fortunately for the French population, about 70%, and now I think even trending higher, got their first shot, and about 55% as of today, I think, is fully vaccinated, right? So adding on top of that the positive cases, etc., it means that the majority of the population has been kind of effectively impacted by either COVID or the vaccines, right? Which of course doesn't prevent you from getting it, but clearly prevents, I would say, the cases to slip effectively into severe cases, and at the end of the day also impacted the healthcare system, right? And I think it's important to remember that at the end of the day, some government, especially, globally, but particularly in France, the reason why I think the governments decided to go for a lockdown is to ensure that the healthcare system were not completely submerged and were able to take care of the COVID patients and other patients, right? So I think that's where France was fortunate enough on getting access to the vaccines, but also pushing it through the population. But on top of that, I think, of course, the economy was massively impacted. But France, being in Europe and similar to some other, I would say, more developed economies, had the fortune to also rely on massive budget deficits and having central banks behind them to fund huge packages, right? Really unprecedented in terms of the scale, supporting businesses, supporting individuals, etc. which is clearly not something that every country around the world can actually do without impacting their ability, their finances overall for the long term, right? But that's one thing that's very important to highlight, and I would say something that unfortunately not everybody globally has access to in an equal manner. But yet, by no means, I would say France is out of the pandemic. And for me, I think what is critically important is that there is a global coordinated response towards the pandemic. If we don't solve it everywhere, it will never go away. And so I think that's where a lot of countries that are now, I would say, more advanced in taking care of the pandemic situation in their home countries need to help, right? And need to help countries that are a bit necessarily, behind in terms of vaccination rates, in terms of access to healthcare, etc. And so that means European countries, I think, and US and other countries globally, I think, need to significantly step up, I would say, their help to countries like Indonesia and some countries in Africa as well, etc. And for me, that's at least my view, and that's the way that we'll be able to solve this really as a whole going forward. And I think that's my, I would say, interpretation of what has happened in France. And unfortunately, in Indonesia, where, if you look to vaccination rates, I think only 20% by now have their first shot and 10% are kind of fully vaccinated. On top of that, the healthcare infrastructure, of course, is not, there's still significant investments that's kind of required, especially if we start looking towards more rural areas, etc. Now, coming to technology and how that has played a major role, I would say, in not only dealing with the health crisis, but also, I would say, helping the economy deal with the pandemic. It's been absolutely critical, right? If we think about from I would say digital health technologies, from potentially in the healthcare sector, great companies in Indonesia like Halodoc, for example, that have enabled massive vaccination as well as enabling people to actually get kind of remote healthcare consultations. Those kind of issues have been very important, and without technology, that would have been able to work, right? In how technology has been embedded, in our workflows. I think today we're still using Zoom, other kind of communication technology, and I think some of the solutions that Martin just highlighted previously are also critical for those kind of things. And I think one sector that I particularly have at heart is the education sector. And I think here, I would say there are some very important and useful technologies that have been developed, but it's still early days. And I think, as was highlighted by both Crown Princess and Martin just now, there is major challenges actually that have actually limited the deployment of technology, particularly in Indonesia. I would say the first one is education for that technology, i.e. do teachers, parents, educators, school administrators, do they understand how to use the technology in the right way? And that becomes actually critically important, because you can have the technology that's ready, but if people can't actually use it to the full extent that it's supposed to be built, then it kind of defeats a bit the purpose. So that's, I think, one critical aspect that needs to be solved is when we think about building technology solution, is we need to ensure that they're extremely simple, right? So that everybody from a 7-year-old to a 70-year-old can actually use it effectively, and it's intuitive in the way that it can be deployed and used afterwards. But the second major challenge is around infrastructure, and that's been a massive challenge in Indonesia, right, in terms of network coverage, as was highlighted by Martin, in terms of access to devices, because a lot of the technologies that have been developed for the smartphone era and to run on 4G or 5G technologies, but not a lot has been, as of today, developed for earlier kind of set of technologies. Now, those two have, of course, then massively impacted, I would say, access to technology, and some sectors, definitely like education, have suffered as a consequence, right? And so if we look to Indonesia, some of those kids have been not necessarily being able to access the education that's critically needed in those early stages of childhood, when there is so much of that learning that will then impact, I would say, the future of those kids. And so that becomes really an important topic to tackle as quickly as possible, right? And so just to give you a bit of a sense for what Pintek has been doing, we started about 4 years ago to build financing solutions for the education sector in Indonesia. So we are providing credit for parents to help them finance the tuition fees of their kids. We're providing access to funds for schools when they need to invest in infrastructure, IT infrastructure, renovations of classrooms, and adoption of technology solutions, but also financing for suppliers, i.e. all of the SMEs that are actually participating in the education ecosystem that would be delivering those technology solutions, delivering the work and renovation at the schools, etc. On top of that, we've also starting developing actually free technology solutions as well for the education sector to help them run better kind of automated operations in terms of managing the tuition fee collection, managing HR, payroll, etc. So, you know, I'm very proud that we can participate in the development of Indonesia's education sector. We've already invested significantly in the country, and really looking forward to working with the rest of the country's, education sector, from, of course, from the government, but the private sector, helping teachers, helping parents, essentially through that very tough times that we're all now going through. With that, I think I will leave it to the next speakers. Thank you so much for having me here today, and very importantly, happy National Day to everybody. Thank you very much.
Thank you, Iwan, coming out of Nice, France. And again, thank you for those remarks, especially as Indonesia comes into our 76th celebration of our independence tomorrow. And thank you for your passion for education. Thank you for those remarks you met and your passion for education. We have here educators from around Indonesia on this panel today. We thank you for supporting the education sector in Indonesia through the various activities that you do and the initiatives that you through Pintek have done. So thank you, Iwan, and very interesting comment on the response in France, because I think this gives a global perspective on how the pandemic has impacted all of us. But I think your two comments about there needs to be a global response and countries need to help each other. That is a very, very, you might say, a very, very positive comment. And I think together with the Center for Public Health of UGM, we can start probably discussing these type of particular themes, of how there is a global response, and also how countries can help each other. So thank you, Iwan, for those comments. and from sharing your experience and what you are doing in Indonesia, but also from your outlook of how France is facing the situation in regards to the global pandemic. And now we will listen to the two Indonesian experts coming out of the Center of Health Policy and Management of the University of Gadjah Mada. The first expert is a leading epidemiologist. He's very well known in the Indonesian papers and probably in media around, because his comments have been the premier reference on Indonesia's response to the pandemic. Bapak Dr. Riris Andono Ahmad, the leading epidemiologist in Indonesia, on your response to this particular issue, and maybe share your thoughts of what our friends here from Stockholm, from France, also from Gusti Kanjeng Ratu Mangkubumi has shared. Pak Riri, the Zoom floor is yours.
Thank you very much, Pak George, and thank you very much for inviting me to this very important discussion among three different countries, two continents. And I'm very honored to be here because I'm part of Sweden alumni. I did my master in Umeå School of Public Health back in 1999, so it was long ago, but I still have a very good memory of Sweden. And Your Excellency, Ambassador Marina Berg, Your Excellency Gusti Kanjeng Ratu, allow me to share my stories, my thought about the current pandemic and what will happen in Indonesia and also globally. And I think if I may start the screen. We know now that globally we start leaving the COVID-19, the Delta variants behind, but the big questions remain, and that is when will the pandemics end? And it was very highly asked questions when we have an early pandemic, but still highly asked questions and relevant in today's pandemic situations. And when in the early pandemics, I found this short movie from TEDx, and it gave a glimpse on how the pandemics can evolve and end. And basically, it offers three different scenarios, which are race through it. So we do not do anything, just go through it. I think it's almost like in the Spanish flu back in 1918 and 1919. Or we have this second strategy, delay the transmission while we try to develop vaccine. And now we have already the vaccine. And I think this is the path that we choose for tackling the pandemic. But there's also the third strategy, a scenario that it's coordinated and trust, meaning that all the government and people in the world have a coordinated effort to stop the transmission. But I think the window was already closed, because it will be very effective when the virus was still in China in late 1919 and early 2020. So now we live in this second scenario that we already delayed the transmission. Your Highness mentioned about the flattening the curve, and that's flattening the curve, meaning that we slow the transmission. But while we're flattening the curve, the consequences is that we prolong the pandemic, because pandemic, the virus fits on peoples who do not have immunity. And we have around 7.8 billion at that time people who still who did not have immunity. And now the situation start to change. Now we have vaccines, I think, from early this year in Indonesia, and we already have this not that fast, but I think compared to other regions, we are still okay. We have the vaccine first compared to our neighboring countries, but since we have a very huge population, around 270 millions, now we lag behind because of we need a huge amount of vaccines to cover 70 to 80% of the population, or even more, if we want to have this herd immunity achieved. So I think now the situation is already changed. There's a lot of countries which has a high proportion of their people vaccinated, but if we compare to the all countries in the world, it's still just a fraction. And if we want to really stop the pandemic, we need to have all the people in the world also has a high coverage of vaccination. So from this one, we can see that though in some countries they already have this achieved the herd immunity, like in Sweden, for example, there still be a possibility that there will be another outbreak in the future, because the herd immunity also has expiry dates, because the protection from the vaccine is not a lifelong protection. So that's something that we have also in mind. And though now we see that Delta variants in countries with higher coverage of vaccination, they still have hit hard. For example, like in the United States, though most of those who are infected are those who do not yet vaccinated, but as also study found that the Delta variant could reduce the efficacy of the vaccines up to 20%. So it will influence how the virus can still transmit globally. And if we see this, we can see that at the global level, we already have this third wave. The first wave was last year, and then we have this early this year. But now we start to see the third wave, and that's mainly can be attributed also here in first we see in India. It's mostly attributed by Delta variants. So what happened in Indonesia? I think to some extent we were lucky, because our curve is not that similar to the what happened globally. We see that before we have only we can say that this is our first wave, that we have quite a significant rise of cases. But now with the after the Lebaran, and we got Delta variant circulated in Indonesia, we see that there's a very high jump in cases. And with the current policy, though the government said that there's a high level of mobility restriction, but it's not well implemented, we can see that the reduction of case is not as fast as we can see in India. And also we have different factors which differs from India. For example, In India, it's a large geographical mass, and we can say that this is one big population. But in Indonesia, we have a smaller, but not only one, but meta population, because we have different islands, and the rate of transmission can be different at different time of the year. So, for example, now in Java, we start to see that the cases are decreasing, but we see a sharp increase in population outside Java. So this also influence how the Delta variants can be tackled in Indonesia. So we expect that we still have a very slow decrease of Delta variant in Indonesia. So with that in mind, I think we also can learn from the past. In 1918 with the Spanish flu, we can see that there are multiple waves before the pandemics end. And at that time, we don't have a significant control technology or strategies. Mostly almost nothing in many countries, only in strong nation like in the United States that they have this mask and quarantine and everything, and we don't even have a vaccine at that time. With that, we need to have 2 years for the pandemic to end, and it was only with the population of 1.8 billion. Nowadays, we have 7.8 billions globally, and we have more mobility globally also, and we have the technology to slow down the transmission rate. So we can expect that the pandemic will stay not only 2 years, but it may need a longer time, because if we want to have the herd immunity, the main technology, the main tools will be the vaccination. But with that in mind, we need to have around, now with the Delta variants, the required fraction of population to be vaccinated is around 85%, because the reproductive rate of the Delta variants is much higher compared to the original COVID-19 viruses. So to be able to have those huge amount of vaccine dose, to be able to distribute all over the world, to be able to meet the vaccination coverage of 85% globally, that will need a very, very long time, and that's create another challenges. So what happened then if while we wait for the herd immunity to happen? Then we will see a multiple wave from time to time. We will see that there will be depending on the government policy, that we will see that there will be many or repetitive mobility restriction policy in different parts of the world, and also in Indonesia. But depending on the effectiveness of the implementation, it will influence the rate of infection and how we can handle those outbreaks. So that's what happens, and it will happen probably in a longer time than 2 years. There is no a good prediction of when will happen. Could be 2 years, 4 years, or even more. And beside that, because we know that it takes a very longer time to be able to achieve the needed vaccine coverage, we might not be able to achieve the herd immunity because the protection of the vaccine is short-lived. Either we regularly vaccinate the population, or then after some times, and we think that it's about a year, the herd immunity will expire, and then the transmission can happen again. And with the outbreaks and with the higher rate of transmission comes a new variants, because with the high rate of transmission, there's a higher probability of mutation, and with the mutation, there's a new variants, which might also reduce the efficacy of existing vaccine. And it's also facilitated with the global mobility, so that I think in the medium term, we still see that the SARS-CoV virus will continuously spread globally, but with the vaccination, it will evolve into become more less fatal, as I mentioned, and but we still see those, we still live with the virus, I think, in the next 3 or 4 or even 5 years from now. And meanwhile, I think to be able to prevent the transmission, and also having prevent the transmission, we also prevent the mutation and new variants. I think this Swiss strategy with different layers of intervention strategy, and with the helps of information technology, and I think this is a very relevant, because information technology can bridge the physical and geographical divide which we currently experience. I think it's really a very relevant time to invest on technology, particularly information technology. With that in mind, I will close the of my thoughts. Thank you very much.
Thank you, Dr. Riris, Andono, Ahmad, and an alumni of Sweden. Yeah, an alumni of Sweden. Yeah, so thank you. And obviously you are our leading epidemiologist in Indonesia. And very interesting comments, yeah, because it's 3 to 5 years, yeah, 3 to 5 years is what we're looking at. So thank you, Dr. Riris. And now, the head of the Center of Public Health Policy and Management of the School of Medicine of UGM, shall make his remarks representing all of us in the panel. Dr. Andre Melala, again, thank you for the opportunity to moderate this session. And now I give the floor to you, Dr. Andre, the head of the Center of Public Health Policy and Management of the University of Gadjah. Dr. Andre, the floor is yours.
Yes, thank you, Pak George, for giving me the opportunity to give a short presentation. I would like to send my greetings to Ibu GKR Mangkubumi yang sudah hadir, and also Her Excellency Ibu Marina Berg, Ibu Duta Besar, and also to everyone who has joined this Zoom meeting. And I just try to give short comments about the 3 presentations from Martin and from Ionn, and also from my colleagues, Dr. Riris. So I would like to present just 2 slides to show you how's the profile of Indonesian health system in terms of doctors and also hospitals. And as Martin mentioned, the disparity of infrastructure and technology is also happened in health sectors. So let me, please allow me to share some of my information. Yeah, Is it already visible, Pak George?
Yes, yes, we can see it.
Okay, sorry. Yeah, let me start with this. Yes. Yeah. So when we talk about the flattening the curve, I refer to what Ibu GKR has mentioned. Then we say that the healthcare capacity is just over here, and then we need to make it higher, the capacity, if the case is going up like this, as what we have experienced in the last 2 to 3 months back. And then is it possible for the health system to facilitate the economic growth through technology adoption when we have such kind of disparity in Indonesians' health infrastructures? This is the example. We have Bali. This is the islands, the main islands of Indonesia. This is Java, this is Kalimantan, and so on. And you can see here the population versus the medical specialists, the number of medical specialists. So all of our medical specialists are mainly in Java Island over here, in Jakarta, in West Java, in Central Java, in Jawa Timur, and over here, down here, in Kalimantan Utara, the north of Kalimantan, and Papua Barat, and Maluku Utara, we have less medical specialists. So this is very challenging to have a strong local health system to support the government program to tackle the COVID-19 pandemic. The availability of doctors is very important, because if there is kind of the side effect of the vaccination, they will taking care of this. And of course, beside that, we need also some kind of complete hospital facilities also to treat the various severity level of COVID patients. So over here, we can see the number of medical specialists is quite how do you call this? The difference is too much, I think. If we compare the Java and also the other island in the eastern part of Indonesia. And also this is related to the number of hospitals that are already established in Indonesia. We have around 3,000 hospitals, and this is the high bar here. You can see that in East Java, in Jawa Timur, and in Central Java, and in West Java, and in Jakarta, and this province are the most populated province with by the medical specialists. And the rest, maybe we can see also the high bar over here. This is in southern Sulawesi. This is also main cities in Makassar, and also in Sumatera Utara, in the North Sumatra, in the western part of Indonesia. This is the configuration of a government hospital, and this is to describe the number of private hospital, but the non-for-profit one. The same case that we have a huge number of hospitals in Java, some are in Sumatra, and even less in other areas. So when you look at these figures, you can imagine that the surface, the access to the services is not really easy for the citizen or the people in this province, mostly in the eastern part of Indonesia. And we look at the number of these hospitals, we can draw some kind of assumption that the quality and also the quantity of services is quite challenging in some part of Indonesia. And if we are talking about technology, then what Martin has presented, I think this is very useful to make the service more equal to the other part of Java Island to increase their access of services for their people. And when we look at the government mission over here, down here, and still even the government itself are still lacking of capacity to serve the patient in terms of quantity and quality of services in some part of Gorontalo, in Western Sulawesi, in Bengkulu, in Sumatra, and other islands. So with technology, we thought that we can make a link from this big hospital to this small number of hospital, so that they can become kind of a sister hospital to endorse the improvement of services or even the capacity of services using the telemedicine or using the technology. So I believe if we are talking about economic growth, so without a strong hospital, we cannot support the economic growth. But then again, how strong is our hospital? This is the hospital readiness that already surveyed, I think yesterday, this is 15 August. We can see over here, excuse me, this is in Bahasa Indonesia. We are still lacking of some points over here about the safe working environment, and also about the use of technology to support. This is related to the surveillance and information management. Normally, if we have driven by this pandemic, this is normally already over here in the very maximum point, but still we have room for improvement to support this aspect. We have 12 indicators over here, and then we can see that the role of technology is obvious. So all of this information collected with information technology, and also we try to communicate with them with very efficient time, because they are very busy to serve the patients. And then is it easy for us to adopt the telemedicine, to do the sister hospital mechanism, or to support the patients outside the Java Island by the doctors in Java to treat the COVID cases? So here is the pyramid of telemedicine. We can see that our policy is not really strong enough up to now, because some local government are still asking about the permission, about the license, and also about the regulations to support such kind of telepractice. And also technology infrastructure, again, this is very unequal. If we compare the highly populated island with the other less populated island. And also the evidence, I think we need to be more cautious about the evidence to use telemedicine, because in some cases this is not easy to control or to maintain the patient's doctor's relationship. Why? Because if we treat patient with telemedicine, so it means that we are also ready to admit them to the hospital whenever the case is going to be more severe. Yeah. So again, back to the support to the economy. If we can try to distribute doctors more evenly to other areas. And if the government invests more in the hospital sectors, to some areas of Indonesia that are already lacking of hospital services, and if we complete this pyramid, and also we support the hospital readiness, then we can get through this pandemic very well. But again, these issues are really challenging, even for the government, because we need a very huge financial support to procure all of these infrastructures. Thank you very much, Pak George. That's all from me.
Thank you, Dr. Andre, the head of the Center for Public Health Service Policy and Management of the University of Gadjah Mada. And Dr. Andre, very interesting. The key is the hospitals. That is very interesting. For everything else to succeed, the economy, it's the hospitals, and technology can help support in the capacity of those hospitals. So thank you, Dr. Andre. And now I'd like to recognize a very good audience here. We have educators. We have also Pak Maksi Gunawan, who is here with us today. He's a leading businessman in Indonesia, and also the chairman of the Honorary Consul Associations of Indonesia. He's the Honorary Consul of Iceland. Thank you, Pak Maksi, for joining. And representing the audience, I would like to invite Mr. Per Berglund. He's coming in from Portugal. But Mr. Per Berglund is one of the leading business persons in Europe. He built many businesses, including one of the most prominent digital banks in Europe, and also is invested in the health sector. So to wrap this whole conversation up, representing the audience, I'd like Mr. Per Berglund to make a comment of what the panelists have shared with us today. And again, to have such a significant figure from Europe here with us today, I think is a great honor. So Mr. Per Berglund, please share your thoughts, and obviously to wrap up this conversation today as we conclude this session of this webinar. Mr. Per, the floor is yours. Coming in from Portugal. Yes, can you unmute Mr. Per?
Oh, now I could unmute. Sorry, I tried several times. I'm sorry. Okay, maybe I didn't get it right, but for just now, I'm in Sweden, Stockholm, but I go back and forth between Portugal. I live in Portugal, but I'm a Swedish citizen. So I go back and forth. For the moment, I'm in Stockholm.
Oh, very good, very good. Thank you, Per. So please, sir, to wrap this conversation up, representing the audience here of educators, businessmen, and policymakers from Indonesia and around the world, as I notice here, maybe share your thoughts.
My thoughts is it's very interesting to listen, because I get the goosebumps when I know that I'm talking to the fourth biggest country in the world. And from my point of view, why we in Sweden, if I say like this, I go back and forth between Sweden and Portugal, and every time I see the differences how we react on this pandemic. Because in Stockholm we are very mature in IT. So if I talk to a Portuguese citizen or a Swedish citizen, it's a different how we react on this pandemic and what kind of possibilities we see in it. I think in Stockholm we have grown. The business has grown rapidly the last years. And we look at Portugal, the other country I live in, it's more tourism and it's more immature. So for me, I see, as I've seen in my companies, it has grown a lot the last year, last 18 months. And for me, it would be fantastic to contribute to Indonesia with our technology as a company as Martin Jacobson or my digital bank or in the health sector or sports sector or whatever. So I see a lot of possibilities, because we have to change. We have to adapt rapidly. That is what I have to say.
Thank you, thank you. So, thank you, Mr. Per. Very, very right on the mark. Adapt. We have
Yeah.
to adapt.
So
So
you have to adapt.
that is the conclusion of this conversation today from the very distinguished panelists from Mr. Martin Jacobson, who shared his thoughts on the experience in Sweden and on the issue of public health, the economy and technology. Mr. Iwan Silber coming in from Nice, France, on the same issue, public health, economy and technology, and also from the two top health experts in Indonesia, Dr. Riris Andono, the leading epidemiologist in Indonesia, most referred to here in Indonesia, which is a Swedish alumni, and also Dr. Andre Melala, who heads probably the most significant center of public health in Indonesia that is basically supporting the Indonesian government in policy making. And not a Swedish alumni, I think you're an Austrian alumni, right, Dr. Andre, from Innsbruck. So thank you for that, Mr. Per. Very, very right on the mark. Adapt, adapt, adapt. So with that conclusion, everyone here today, we thank you, everyone, educators from around Indonesia, members of the Chamber of Commerce, members of APTISI, members of IABC, and obviously the community that is organized under the leadership of the Center of Public Health Policy Management of the University of Gadjah Mada, led by Dr. Andre Melala. We thank you all for joining this conversation. This will be a series of conversations of public health, economy, and technology, how the world is coping. But with Mr. Per's remarks, I think, Dr. Andre, that pretty much signifies the reality of today, right, Dr. Andre? Adapt, adapt, adapt. And therefore, in ending, I would like to thank Gusti Kanjeng Ratu Mangkubumi, Crown Princess Gusti Kanjeng Ratu Mangkubumi, the Crown Princess of the Royal Palace of Jakarta, and Her Excellency Ambassador Marina Berg, to provide those great opening remarks to begin our conversation today. And for everyone here, as we embrace tomorrow the 76th independence of the Republic of Indonesia, kawan-kawan semua, kita akan merayakan kemerdekaan Republik Indonesia besok. For everyone here, may I say, Merdeka. Let us embrace our Independence Day today, tomorrow, and thank you for everyone here coming in from Yogyakarta, from around Indonesia, from Stockholm, from Nice, France, and from around the world who has joined us today. Thank you, and I end and conclude this session. Thank you for University of Gadjah Mada. Goodbye, and have a good afternoon. Merdeka.
Merdeka.